You're bleeding, and it's not the kind a simple Band-Aid and a mother's kiss can fix. This is the kind that pools beneath you, the kind that narrows your vision into a tunnel and turns your legs into unreliable suggestions. Just 10 minutes ago, there wasn't a gaping hole in your body, and now, the nearest hospital is either a pile of rubble occupied by trigger-happy individuals, or 300 miles away, through land crawling with hostiles. There's no ambulance on its way, no surgical team in sight, no comforting morphine drip. It's just you, a bathroom cabinet stocked with dubious supplies, and the very real possibility of becoming someone's fertilizer. But here's the thing about bullet holes. They're surprisingly egalitarian. Doesn't matter if you're a seasoned survivalist, a desperate scavenger, or just plain lucky. The human body bleeds the same way. And if you know what you're doing, if you can keep your hands steady and your rising panic at bay, you just might be able to staunch that flow long enough to see another dawn. So, no pressure. We're about to delve into field medicine, apocalypse style. Step 1. Stop the bleeding before you become a statistic. First priority is pressure, not the existential kind, though you're likely drowning in that already. We're talking physical pressure. Scour the immediate vicinity for the cleanest cloth-like object you can reach. A t-shirt, a towel, even a curtain will do. Hell, if all you've got is a sock, grab it. Fold it into a thick pad and apply direct pressure to the wound as if you're trying to smother a small fire, because in essence, that's precisely what you're doing. You're smothering a hemorrhage before it turns you into a rapidly deflating meat balloon. Hold it firmly. Resist the urge to peek.
This is gonna hurt.
Don't lift it to check if it's still bleeding. Of course it's still bleeding. You have a hole in you. If the cloth becomes saturated, don't remove it. Add another layer on top. Removing it will tear off the nascent clot you're desperately trying to form, and you'll be back to square one, only now you're even dizzier and the room is spinning like a broken carousel. If the wound is on an arm or a leg, elevate it above your heart. Gravity is free and surprisingly effective. If it's on your torso, well, you can't exactly levitate your liver, so skip this step and keep applying pressure. Step 2, the tourniquet, when pressure alone isn't enough. If the bleeding is arterial, pulsing, bright red, and spraying like a busted radiator hose, you need a tourniquet and you need it fast. Find something roughly 2 inches wide, a belt, a torn strip of denim, a dog leash. Crucially, not a shoelace and absolutely not wire. Those will slice through tissue like a cheese cutter, and you'll lose the limb for shrink. Wrap it tightly around the limb, a few inches above the wound, positioning it between the wound and your heart. Secure it tightly, then find a rigid object, a stick, a pen, a screwdriver, and twist it like you're winding a clock. Tighter and tighter until the bleeding ceases. It's going to hurt like hell. That's how you know it's working. Mark the time somewhere clearly visible. Use a Sharpie on the skin, blood on the wall, whatever works. A tourniquet left on for too long will kill the limb. You have approximately 2 hours before the tissue begins to die. After that, you're choosing between bleeding out and amputation. Fun time. Step 3, clean the wound or invite infection to the party. Assuming you're not dead yet, congratulations. Now comes the critical part where you prevent sepsis from finishing what the bullet started. You need to irrigate the wound. Translation, flush out the dirt, fabric fibers, and whatever other unsavory hitchhikers manage to find their way inside your body. Boil water if you have the means. Allow it to cool until it's warm, not scalding. If you don't have a stove, use bottled water. No bottled water? Tap water is preferable to nothing, even if it tastes like rust and regret. Pour it directly into the wound, not a gentle dribble, but a steady stream. Your goal is to wash away debris, not baptize it. If you happen to have saline solution, use that. If you have hydrogen peroxide, use it once to help bubble out the grime, but don't overdo it. It can damage healthy tissue. If you have vodka or whiskey, save it for later. Alcohol stings like the devil, isn't as effective at sterilization as you might think, and you'll likely need it more for psychological comfort anyway. Pat the area dry with a clean cloth, or at least the cleanest cloth you can find. Let's be honest, nothing is truly clean anymore. Step 4, pack the wound, because holes don't magically seal themselves. If the bullet passed cleanly through entry and exit, you've got two problems to address. If it didn't, you've got one gaping hole in a piece of metal playing hide and seek with your vital organs. Either way, you need to pack the wound. Find sterile gauze if you can. If you can't, find clean gauze. And if even that's unavailable, find the cleanest piece of fabric you can get your hands on. Rip it into strips if necessary. Start at the deepest part of the wound. Gently but firmly, push the gauze into the cavity using your fingers or a pair of tweezers. Don't just cram it all in at once. Layer it carefully. Think of it as stuffing a tiny, horrifying
turkey.
Don't
you lie to me! I know
the
exactly
objective
what
here is simple. Completely fill the void to apply internal pressure. You're trying to staunch bleeding you can't even see. There's a sweet spot to aim for here. Don't pack it so tightly that you cut off all circulation, but don't pack it so loosely that it's ineffective. Aim for firm but forgiving, like a mediocre handshake. If there's an exit wound, repeat the exact same procedure for that one as well. Once both wounds are packed, cover them with a larger dressing and secure it with tape. Medical tape is ideal, but duct tape will work in a pinch. Scotch tape is a joke, but if it's all you have, you'd better layer that thing like your life depends on it, because it does. Let's move on. Step 5, antibiotics. This is the crucial difference between survival and sepsis. Infection is the silent killer that comes after the main event. A bullet might miss your heart, but bacteria doesn't care about your luck. If you have antibiotics, amoxicillin, doxycycline, anything broad spectrum, start taking them immediately. Adhere strictly to the prescribed dosage. Don't you dare skip a day simply because you feel fine. Feeling fine is a treacherous lie your body whispers right before it decides to shut down entirely. No antibiotics? All right, don't panic. Look for honey. I mean real honey, not that corn syrup garbage in a bear-shaped bottle. It possesses natural antimicrobial properties. Smear it liberally on the wound before you apply the dressing. It might sound like something out of the dark ages, but it's backed by some science and, more importantly, by sheer desperation. Garlic is another option. Crush it up,
is the key
mix
point.
it with a little oil,
You must remember
and apply
this
it to the
detail
gauze.
above all
Yes, you'll
else
smell like
if you
an
want to
Italian
succeed.
restaurant, but you just might stave off a fatal infection. It's all about calculated trade-offs. Step 6, monitor for shock. Your body is prone to dramatic overreactions, and shock is how it tends to overreact to trauma. It claims more lives than the actual initial injury. You need to be vigilant for the telltale signs: pale skin, a racing pulse, shallow and rapid breathing, confusion, cold sweats. And here's a particularly alarming tidbit. If you're assessing these symptoms on yourself and you realize you're experiencing confusion, that's an extremely ominous sign. If you feel shock creeping in, lie down immediately. Elevate your legs if possible. Get warm. Use blankets, jackets, whatever you have at hand. Sip water slowly, but don't chug it. Your stomach is in no condition to process a gallon of anything right now. So why does any of this actually work? Your body is already valiantly fighting to save you. Blood clots are simply your platelets sticking together like microscopic sandbags. The pressure you're applying helps them accumulate faster and construct the dam. A tourniquet merely halts the flow of blood to the damaged area, buying you precious time. It doesn't resolve the underlying problem. Packing the wound generates crucial internal pressure and provides your tissue with a framework to begin rebuilding. The antibiotics or the honey serve as your special forces, dispatched to eradicate invaders before they can establish a colony. Your immune system handles the rest. If you manage to survive the first hour, your odds of survival double. Survive the first day and you might actually make it. And that brings us to the sobering reality. There's no pristine hospital, no skilled doctor rushing to your aid. It's just you, some makeshift supplies cobbled together, and a stubborn refusal to succumb to death on a filthy floor. But look at you, the wound is packed. The bleeding has subsided. You are still breathing. In this unforgiving world, that constitutes a victory.
Don't you lie to me!
If the pain starts to recede and a fever never materializes, then congratulations. You did it. You survived. If the wound becomes alarmingly red, swells up grotesquely, and begins to emit the unmistakable stench of decay, well, you gave it your best shot. And out here, the act of trying carries significant weight. Now get up. You've either got a bullet to dig out later or a grave to avoid. Either way, you're far from finished.